Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Welcome, everyone. Today on the podcast, we have a really special guest. But before, let me introduce myself. My name is Diana Ferreira. I'm a certified lifestyle medicine physician, and I'm a lecturer at the European School of Lifestyle Oncology. I'm also a cancer survivor, and I'm super happy to be here today with Aileen Alegado. Dr. Aileen is a registered clinical psychologist and director of Mindset Consulting, a boutique Sydney CBD practice specializing in therapy for corporate professionals, executives, and high performers. With over 15 years of experience across Australia and New Zealand, she combines chemotherapy, CBT, and ACT approaches to unlock human potential and address complex psychological challenges. Currently serving as an in-country expert for Unmind, a leading global digital workplace mental health platform, she translates complex psychological concepts into practical strategies for optimal performance. Aileen is the founder of Envision Wellness Retreats, offering immersive experiences that integrate psychological principles with holistic well-being practices that go beyond the therapy room. She's a certified psychedelic-assisted therapist, and she will become the first Australian-based psychologist to host overground psilocybin-assisted wellness retreats in Portugal, offering transformative experiences for those seeking deeper healing and personal growth. Through her diverse professional endeavors, she maintains a commitment to ethical, evidence-based practice while embracing innovations that expand the possibilities for healing and human flourishing. Welcome, Aileen. It's such a pleasure to have you on the podcast.
Wow, well, what an introduction. And I'm so pleased to be here with you, Diana.
Thank you. Thank you so much. It's really exciting for us because I'm actually based in Portugal. So it's exciting to know that you're hosting your first retreat here. So let's start this conversation by talking about lifestyle. And you know that when we talk about lifestyle, immediately people think about physical activity and nutrition, and which are really important aspects of a good lifestyle. But we end up talking way less about mental and emotional health in the context of lifestyle. Um, why do you think this happens, and why does talking about mental and emotional health really matters?
Yeah. Well, I think historically we've tended to compartmentalize health into separate boxes, right? Like physical over here, mental over there, and then spiritual somewhere different entirely. And so Western medicine and that biomedical model has developed a mechanistic view of seeing the body. But what we know is that it's a lot closer in terms of that body and mind connection. So often we talk about lifestyle as, diet and exercise. And perhaps it's because it's what we can see tangibly and it's something that we can directly influence. So things like, run 10Ks or eat more vegetables, or you can see your weight on a scale. And so often we try as human beings tend to focus on the things that we can control. And so I think for a very long time, there's been a lot of focus on that physical aspect, but not really kind of recognizing something that's maybe a little bit more nebulous or abstract, such as mental and emotional health, right? Because it's actually more of an invisible factor into our holistic life. And so I think that separation is actually what's initially created that. But now there is much more, of course, a movement towards understanding that, you can't just do the physical stuff, because that really relates to how you feel emotionally and mentally. When we exercise, we feel good, and vice versa. When we're not feeling the best and we're quite stressed and we have a lot of worries, in our minds, that definitely has physiological effects. Like we could get inflammation and we get, symptoms of fight or flight, digestive issues, and things like that. So more people now are switched on to this mind body connection, which is fabulous. And it's definitely a changing landscape in terms of how we see lifestyle, that it is incorporating not just, what we can see, but much more of also kind of the processes that goes on inside of us.
Yeah, which is brilliant, and actually, it's interesting because we describe it quite often as body-mind connection, but the way you describe it is more like it's actually the same system. It's just one thing that maybe we can be objective with the indications from the body. We can't with the indications of the mind, but it's actually both systems are actually part of the same system.
Yeah, it's not one takes over the other. It's like a system that is a holistic, ongoing system. And I often say to my clients, if we have these different prongs to approach change, a dietitian might approach that change through the diets. And so that's probably much more physical. But in saying that, that has effects in terms of what you think about yourself and your mental health and your energy when you are eating well. And if you see a psychologist might have their approach based on, your thinking and then what you do in terms of interpreting certain events. And so that might change behavior, and then that might change, how you do feel physically as well and what you engage in. And so it's a lot less like causal, and it's a lot more kind of a complex kind of interplay between all the different parts.
Yeah, absolutely. It's such an interesting field, this one. And we're sort of an organization focused on lifestyle, all these pillars of lifestyle. And it's really interesting that, and particularly in the context of cancer, because we do work in that context, um, people can become really focused on, these things that we just mentioned, nutrition, physical activity. And to some degree, that's what we encourage to. I see it quite often in practice, though, people trying to over control these issues. And I question myself if that's a healthy pattern, to be overly concerned with these particular issues, sometimes causing more stress to yourself. So, what's your view on trying to navigate this balance of, having a healthy lifestyle, but at the same time, uh, maintaining our emotional and psychological balance?
I think this is such an important question. Kind of how do we focus on our intention and balance rather than being obsessive and having rules? Yeah, because that's kind of, essentially what people, you kind of end up kind of going through that very fine line of doing something that's healthy, but then done in a certain way with all sorts of rules and parameters. It ends up becoming unhealthy. Yeah. And so the intention behind those changes matters a lot. So are we making these changes for example, from a place of self-compassion, or are we doing it with a lot of self-criticism? Yeah, because psychology research have shown that when there is shame and fear that is driving change, they're often poor long-term motivators. As in,
Right.
we don't end up kind of having a sustainable and healthy approach to that change. No matter how good the change is, it kind of falls over at some point. And so what works better is making changes that aligns with deeper values and a sense of purpose. So an example of that might be, I want to be healthier, and feel healthier, which is much more of a value and purpose statement as compared to I need to eat organic foods only. Yeah. And
Yeah.
I guess in a metaphoric way, I often describe this to my clients by saying, think of it like you're trying to grow a garden from a contaminated soil, right? You plant the healthiest seeds, you've got the perfect diet, you've got the ideal exercise routine, and you follow things down to a T. But if the soil itself is toxic, as in, you are full of self-criticism, fear, this perfectionism, it ends up starting to control you. Yeah. And eventually what plant that grows out of that soil can reflect some of that toxicity. And,
Yeah.
whenever we're trying to do something, I suppose that's health supportive choices, it should ultimately expand our capacity for joy and expand our capacity for connection and essentially a meaningful life rather than restrict it. And when we
Yeah.
when we are trying to control a lot, I always ask my clients to reflect on, who's controlling who? Are these habits, feeling empowered that they're habits that you have some flexibility with? They're almost guides as to how you would like to live. Or do you feel like it's actually restricting or limiting what you can and cannot do? And there's probably like a lot of tension experienced in being able to kind of fit into this lifestyle.
Mm.
So asking
Yeah, that's
asking those
yeah.
questions and the feeling intuitively of what is happening and how helpful or how much is this serving you ultimately?
Yep. That's a great question to ask people. Absolutely. Thank you so much, Aileen. It's such a beautiful perspective, and I'm super happy you touched on the research in terms of long-term impact of, making choices that are actually aligned to your deeper values. And also because I also see that there's a perhaps like a old style line of work in health professionals that it's more geared towards the shaming and the you really need to improve these, and people make lots of changes out of fear sometimes. And yeah, and I was wondering what the impact would be in terms of, raising cortisol levels, feeling that everything is controlled not by them but by their conditions. So that's super interesting. Thank you. And I was going to ask you as well, when you have either a mental health condition or when you experience trauma, developmental trauma or adult age trauma, I find that some of these behaviors people may present that are considered unhealthy, like eating too much or not sleeping properly, etc., may actually be adaptive to their circumstances. Would you mind expanding a little bit on that? What's your experience around, pre-existing trauma and uh, lifestyle behaviors?
Well, I guess it's about the sequencing, right? Like what do we treat when there's kind of multiple things happening for this person at once? And what I've found is just understanding a little bit about trauma and mental health, that it impacts our relationship with our bodies, our sense of agency and safety. And so knowing that if someone has those unresolved traumas, then the foundation for safety and choice and feeling empowered is very low in these individuals, right? So someone with a trauma history, even if you have well-intentioned health advice that you're giving them, it can kind of really trigger feelings of being controlled or them just becoming more overwhelmed, because what might seemingly be um, helpful advice or maybe a treatment plan that is given to them to treat one thing, it really depends on their capability in that moment and assessing whether that might going for a walk every day might feel like climbing Mount Everest for them with where they are
Right.
at the moment. Yeah. So making sure that there is a personalization of one's experience and that we hear where the person is at and treating the person where they're at, so we can make steps for those people to essentially um, essentially plan for success. Yeah, and like and kind of not set them up for failure, and not assume that all cancer patients have to go through these specific steps, in a very formulaic way. And so often there is differences, as we know, with where people are at in their journeys, not just from like the physical kind of diagnoses, but also their own processing of it mentally and emotionally. And as you say, maybe other predispositions that exist within that, such as mental health, um, mental health issues outside of, let's say, having cancer. And so, yeah, so it's absolutely crucial for people to be set up for success rather than failure, and to have a trauma-informed approach where we are meeting people where they're at and that they are empowered in the process, that they're not further victimized by us trying to help them and us telling them more things to do that they're not able to maybe at the time, that makes them feel even more crappier about themselves.
Yeah.
Right. And
Yeah.
that even though we know that, say, exercise has powerful benefits, but expecting someone to immediately go into a rigorous exercise routine can backfire if they're not at that place. Or, somebody that kind of has a lot of issues with their eating, or, like if they have got problems in their relationships, which might make their home unstable, which is often really important for support. Community support is really important where we're trying to implement these really good habits, and
Right.
sitting with that person, acknowledging what those issues or barriers might be that gets in the way of them creating this kind of healthy path for healing.
Yeah, absolutely. And it's really personalized medicine, what you're describing, right? Really adapting your intervention to the person you have in front of you. That's amazing. Um, so, in terms of mental and emotional health during cancer, I think this is a challenge for many people that who come to us. Basically, I think before having cancer, many people are running their lives to try to take care of many other people. And the first time they're diagnosed is actually when they feel the need to start responding to their own needs. But at the same time, this is sometimes really hard to do because we're not really trained to respond to our needs. We're more trained to sort of, take care of other people, and particularly women. Um, so how do you think, first, do you find this in your clinical practice? And if so, how can we start listening to our needs and to respond to that?
I mean, this is a big question only because I feel like this goes back to undoing generations of emotional disconnection. I think as a society, um, we have a lot of work to do where we have grown up in families and cultures where emotions were seen as weaknesses and inconveniences rather than valuable information. And so the good news in developmental psychology is that um, emotional intelligence, or learning more about your emotional health and being attuned to this, is a learnable skill. So often it's just starting from, where is my baseline in terms of how comfortable am I expressing emotions, feeling emotions, and especially, for people that have been diagnosed with cancer, there's going to be a lot of emotions, right?
Right.
It can be overwhelming. And so starting with, yeah, just challenging maybe any negative beliefs that you might be holding from your family or ideas that you might get from society that, like, I don't want to be a burden, so I'm just going to say I'm okay, like, rather than being more truthful about where you're at and how you're feeling, right? And also for our communities and being around people that we know that we can be safe when we do open up that vulnerability. So I think that this is kind of a team effort, both on the individual learning how to comfortably express emotions that's authentic to them, and being open to that vulnerability. But it's also, each and every one of us, friends, families, communities, that could model a positive reception and receiving difficult emotions as well. That if you are someone who is supporting someone with cancer, it's also about being able to sit with difficult emotions that we might typically or feel naturally want to problem solve, or we might want to kind of redirect because we don't want to be too like negative, or we're afraid that this person might cry, but maybe that's a projection of our own um, inability to hold emotions and what we think about negative emotions. And so it's about challenging those kind of internalized feelings that we have about it, and as a community, building this like emotional resilience and like an emotional safety, so that people can actually get their needs met. And then if not, they can actually communicate how they're feeling in an authentic and honest manner, and then that we can show some compassion towards that.
Yeah, that's brilliant. And it's such a perfect segue for my next question, which is about toxic resilience. And I know you talk about toxic resilience as well. So I was wondering if you could define the term for us. What does it mean? How it shows up in people and relationships?
Yeah, well, toxic resilience is where we mistake emotional suppression for true strength. Yeah, so resilience as a word means our ability to bounce back from adversity. Yeah. And so I think in the context of cancer, there is a lot of this pressure to be the perfect patient, if that is you, to always be positive, to never complain, to fight valiantly. This journey, this kind of positive way that I suppose it's inspirational to others, but if it's not coming from an authentic place, or if there isn't room for other emotions to be expressed, like, when you are feeling down, and that there is such a continuum of emotions that one would go through in their cancer journey, not just bad or good, but also all the things in between. So I think it's about acknowledging that in order to be truly human, that we access or we communicate or we can show that it's not just about trying to fight the fight, or it's not just kind of then surrendering, but there's so much more depth to resilience, and how that looks like in individuals that are kind of at different points in this struggle. And I think the main key takeaway here is that, this is not just for people with cancer, but I think it's also how we see suffering um, as a whole, as a society. Because, with acceptance and commitment therapy, that's one of the psychological frameworks that I work from. A lot is said that psychological flexibility comes from not controlling difficult experiences, but meeting them with openness, kind of having a sense of like mindfulness and noticing them without being kind of overtaken by them, without it
Yeah.
being something that we get kind of swallowed by, so because
Right.
so many things in life that we can't control. And this is where practices like gratitude exercises help, because there are
Right.
going to be things that are going to be working for us. Yeah. And being a little bit more
Right.
honest about those moments that when you are not coping, to not sugarcoat that, and that is also part of the human experience. And hopefully with those moments, that also allows for real deep connections because of the vulnerability. Yeah. So
Right.
with toxic positivity, you're getting seen in one light, but you're probably missing out on other connections that are just as important when you are showing vulnerability or during those moments that you are finding it difficult and hard to cope.
Yes, it's a beautiful work by Brené Brown on vulnerability and the power of vulnerability as well for human connection. And also based on that, Aileen, this is a question also we get asked a lot when we start diving into emotions, and you sort of touched on that, but would love to hear more. So I think in one end of the spectrum, we have this toxic resilience, but at the other end of the spectrum, I guess we have a sense of victimhood and not being able to feel agency in relation to your situation and condition. How do we know that we're not? What's the difference between just allowing your feelings to be expressed and falling into victimhood without being able to react, I guess, or act in an empowered way?
Yeah. Well, look, I think it comes down to the quality of your thoughts, right? You could kind of tell that if somebody, because someone can kind of feel like they're a victim. So they feel sad that this has happened to them. And I guess it's about your ability to change or have alternative ways of thinking and
Right.
reframing that mindset. That, obviously that's one interpretation that goes with that feeling. But, if I was in that moment able to sit with that and then later say, well, actually, you know, considering that I have got this, and this is where, changing the way you're thinking and your mindset, there was cognitive behavioral therapy principles here now in terms of what is another interpretation, right? So a typical one about victimhood is things happen to me is the interpretation, and I'm helpless and hopeless about that. And you just change something really small there. And if you start thinking things are happening for me, okay? A very small change, but it changes the meaning of that uh, mindset entirely, because now that same person that was feeling hopeless and helpless, if they thought about it in this way, they would start to think, oh, perhaps this is an opportunity for me to clarify what is important in my life. Perhaps this is happening so I can, evaluate, my values and whether I am living life according to my values, and have a sense of agency to change those things.
Right.
Yeah. And so I always
Yeah.
say that, like, how you're feeling about something is often attached to the interpretation. And of course,
Right.
most of the time, the interpretation is valid because there's, reality in that. But there are different ways of reframing that is same interpretation ever so slightly that moves the needle a bit, that kind of allows us to kind of then in that continuum of agency and empowerment or hopelessness and helplessness, wherever you are on the scale, can kind of move you around. And so hopefully that means that you're never really stuck unless
Right.
unless you kind of refuse to consider these things that we're talking about.
Yeah, it's changing your belief system as well and the way you think. Absolutely. So That's what you said is super interesting, Aileen. Also because it validates so many people's feelings, and I guess we have some patients that actually voice that, which is, okay, I have cancer and that sucks, but now I have time to be at home and to do things that I never thought about doing in a million years because I had a busy life, etc. And I think there's a sense also of guilt when these feelings come. And what you're saying is there's actually really key things that are happening for us. And that's actually normal in the process,
Yeah.
right?
Yes. And here's kind of just like, as you say, honoring um all the emotions that come. And when I say that it's not about just having positive emotions only, and it's not about just having negative emotions only. It's actually hopefully having the whole breadth of the human emotion spectrum, and being able to kind of, yeah, just understand this is part of the journey, good and bad and neutral. Yeah, and
Right.
that is actually resilience, to be able to experience and move from one emotion to the other. And yeah, we hopefully could do that with self-compassion. We hopefully can do that with a lot of support and connection with other people. Um, and when done well, when we have seen people that have gone through challenging journeys, um,
Right.
we see post traumatic growth. This is not an imagined rainbow at the end. Many people have walked this path with exactly some of those changes or discussions or challenges that they have overcome, and often would talk about, yeah, like some level of growth or change, meaningful connection to something and the other side.
Right. Yeah. Absolutely. And would love to bring that into discussion as well because uh making meaning of something like cancer, and I guess the whole cancer journey, I guess it can frequently bring an identity crisis as well. So all of a sudden you feel like your priorities change. All of a sudden you might not feel exactly good in the same group of people. You might want to do different things. And it's actually we're running survivorship groups as well, and it's frequently in the survivorship phase where people are actually questioning themselves and like, what do I do now? Who am I at the moment? And all of that. So, and I know it's a big question again, but about these identity crises and these questions that people may have around their own values and not fitting in where they previously felt at home.
Mm.
Do you have? I was wondering if you could talk about that, but also provide some insights and tips for people who are going through these situations.
Yeah. Um, Cancer often creates what psychologists call biographical disruption. So that's like a profound shift in how we understand ourselves and our place in the world. Now, normally, without cancer or in a normal kind of lifespan, that happens anyway. Like identity evolution tends to happen. Who you are at 20 is not the same person at 30, it's not the same at 40 or 50. But obviously, a diagnosis of cancer, and when it's unexpected, often it's like you reading a book about your life and having an idea of what that is a book is about, and then all of a sudden somebody gives you a completely different book. That's kind of what it
Yep.
it feels like, right? And so it's completely normal for values and priorities to evolve through the experience of just trying to kind of find out, well, what does that mean? What do I do now? And do I just completely like start from scratch and all over again? So, like with any kind of trauma, because I think this is traumatic to kind of have your life be kind of, you know, like like have the rug pulled from underneath you, and for you to consider, oh, I would have to have a different life now. And like with any big major disruption in your life, you've got to go through the process of grieving that loss, of
Right.
who
Yeah.
you thought you would be and what you thought life would be. And that is pretty natural. There's a lot of emotions attached to that with the stages of grieving. So that's bargaining, depression, anxiety, hopefully get to the point of acceptance, shock denial as well in the beginning. But what we do know is that once those natural processes of grieving and loss starts to happen, we know, especially in the cancer research, there could be a very clarifying effect with
Right.
this biographical disruption. So as bad as it seems like in the beginning, often when people are doing it with a lot of support and with some of the things that we're talking about here with the lifestyle, um, healthy lifestyle changes, people can then be very clear about who they are and what truly matters. Yeah. So
Right.
that's actually, again, it's part of the post-traumatic growth. And I guess there's some practical ways that you could get there sooner, yeah, rather
Yeah.
than later. And it just all comes down to, being able to give yourself permission, not fighting, not resisting that this is happening, but more giving yourself permission to evolve. I suppose things have to change because things have changed. And so not only is it normal to kind of go along with it, but to try and reframe this as something that might be potentially meaningful, right? That
Right.
we are always in the process of becoming a person, a person in the future that we don't know about anyway here in the present. Yeah. So kind of just being open to that process. And that this process is normal, I mean, in this case, it's cancer, but it could be, something else for someone else that has had um, a major trauma or a milestone in their life that had taken them in a different direction, right? The same
Yeah.
applies. I think being able to communicate and speak about these experiences so that people that are around you, your loved ones, um, could understand where you're at and hopefully be able to meet you in your new reality.
Right.
Their support is important, and understanding that sometimes people can take some time, and so being patient with them is important because they can take time, not because what you're doing is difficult or they don't want to. It's just they're having to adjust to that new reality
As
as
well. Yeah.
well. Yeah. And like finding people that you can be real with and that you can have that kind of non-judgmental, unconditional support. So cancer support groups are very good with this,
Yeah.
because just from the perspective of a group of people that understand and what you're going through, so that's helpful. And then yeah, so I think it's a lot more about like how do we encourage or invite connections and invitations for our environment to match what our new reality is going to look like. Yeah, and the
Right.
more that we create those transitions or the more that we help and allow with compassion those transitions to unfold, then the better off we can cope with the changes in identity, cope with the changes of, what's next and who am I, because that will hopefully kind of unfold over time. And what we know is that, like anything that like often if you see relationships as a permanent fixture, you'd be very disappointed
Right.
because in life, we know that they're like seasons, people come in your life for a reason or for a season or for a lifetime. And there's kind of a reason that we don't kind of have everyone from the beginning of a journey finish at the end of the journey with us because that's kind of not how life works. And so the more that we also understand that saying goes with identity and people that come and go in our life, that sometimes is the way that normal evolution and growth works.
Yeah, and that's such an interesting point. The fact that we're constantly evolving, whether you have cancer or not. But yeah, of course, a situation like cancer is accelerating that. But I love that you mention it because there's many times the illusion that after treatment we can go back to what we were. And that's actually not possible, but not possible in life in general, I guess, but also in the context of such an experience. So love that if you look towards the future and what you want to create is actually much more empowering than trying to get back to something that you're not anymore.
Yes. And sometimes when people do talk about fondly about a certain time in their life in the past, you could kind of do that, but maybe more abstractly, and understand, okay, well, what is it about that time in your life that you enjoyed, in particular? What is it about that? Because it's not so much the time and recreating the time and being the same person, right? Because you would never be the same
Right.
person ever again. If anything, we would hope that you're a better person. You just take what you find fondly at that time now, and wouldn't that be better with all of the wisdom, with all of the resilience, all of the strengths that this person had overcome, and now
Yeah.
what we kind of could create and do with that.
Yeah, absolutely. And so would love to bring another topic related with the experience of cancer and that people report a lot, which is the language used to um, address, I guess, survivors in a sense, or a person with cancer. And we hear a lot from our society and even from health professionals things like you're such an inspiration, you are a warrior, lots of bellic language to talk about cancer. And I guess for some people it might be useful, for many people it's not. How can we improve our language around cancer? And I mean, I talk about cancer because that's what we're focusing on, but I guess uh, it's an issue with vulnerable situations, whatever they, or situations that involve suffering, I guess.
Yeah. Like battle metaphors can be both empowering and
Yeah,
limiting, isn't it? Like language like cancer survivor or cancer warrior, and these are such loaded identities that people might not even choose for themselves, right? And they're meant to
right.
be empowering, and I think for some it works, but certainly, what does that do to people that might feel like they're struggling a bit, and that doesn't fit like their story, and it creates so much pressure for those individuals. When we say someone lost their battle with cancer, what does it imply about that person's effort or character, right? It's kind of, it
Right.
gives this false kind of need to outperform, to be the best, and kind of goes back to that toxic positivity of perhaps
Right.
not acknowledging that their journey is not just about just fighting valiantly all the time, but it's actually about experiencing um authentically the lows that comes with the struggle. And so
Yeah.
I think like having more neutral words or language around cancer, neutral language like a person with cancer or person living with a cancer experience is probably a little bit better. But also in terms of when you're communicating with someone, I suppose to just be mindful when you're making assumptions, and to not make assumptions, but instead be led by them and their experience. So, asking open questions like, "How has this experience been for you?" Or "What would be the most helpful for me to understand?" Or, yeah,
Right.
kind of just like leaning more into what they are saying about themselves, and then going with that rather than us jumping with our own assumptions and probably saying a lot of these things that could be positive because we're trying to be like uplifting, like you're so inspiring, but it can also feel like it can create distance and pressure because we don't really know what's really going on inside of them for them.
Right, right. And which is also, it confronts us with our vulnerabilities, as you were saying before. So I guess it really takes practice for us as people who are supporting people with cancer to actually be vulnerable enough to listen and to really engage without trying to make things better, I guess.
Yeah.
Yeah. All right. So I would really love to touch on the psychedelic assisted therapy because you are a certified psychedelic assisted therapist. Um, would love you to define what psychedelics are, which actually here in Portugal is quite a new field of knowledge, and how are they used for health purposes?
Yeah. So psychedelics are substances that are that temporarily alters our consciousness. So it's things like psilocybin, which is the active ingredient in magic mushrooms, MDMA, ketamine. There's also other ones like ayahuasca, DNT. But I guess when I refer to psychedelics, I often would be just focused talking solely for our conversation today on psilocybin.
Right.
But also some MDMA effects. So what's remarkable is how they're now being studied to the extent that there has been a lot of positive and very promising results um for these compounds to be really helpful in mental health treatments. And in fact, in Australia, it has been legalized specific to treatment of treatment resistant depression for psilocybin and for MDMA, that it can be used for mental health treatment for people that have got PTSD or post traumatic stress disorder. So that's already happening now. So we're kind of entering our third year into it, which is very exciting. So all of the years of clinical trials and that being shut down back in the Nixon era in the 50s and 60s and 70s, there's a major resurgence now. And the science is really truly behind it. And what we know about psilocybin, for example, is that it actually works like our brains have a default mode network, right? So we have
Right.
these patterns that our brains understand or narratives that we have about ourselves, about others in the world. And under um, psychedelics, those beliefs are much more relaxed. Okay. So it's
Right.
it's like it's a lot more relaxed, and the opportunities for different parts of the brain to connect and talk to each other increases. And so now that window where the access to perhaps thoughts, feelings, ideas, memories that normally are kind of shut out or are normally kind of not really even there, has an opportunity to come out and be conscious. It's about making some subconscious up to the conscious level. And that is therapy gold for a therapist, if you think about it.
Right.
There is that
Yeah.
window of being able to rewire or reimagine someone's narrative, which in anxiety and depression, or I suppose in cancer, it could come as end of life anxiety. That can be ruminative and go round and round and round and rigid. Um, has an opportunity to relax, and then the different parts of your brain are allowed or is activated to talk to each other to create different perspectives. Okay.
Wow, that sounds amazing. And yes, with lots of potential within the cancer realm as well.
Yeah, absolutely. In terms of like creating meaning and creating, connection to oneself and others. We talked about that interpretations are very important in terms of
Right.
post traumatic growth. And when people are stuck in negative narratives, or they have had also, traumas themselves that obviously reinforce a lot of these deep-seated beliefs. And you have a tool that relaxes that and gives you a small window to work with it.
Right.
That's quite a therapeutic gold, and that's magic, right? Like to be able to
Right.
have that. And so psychedelics give us the platform. I mean, people talk about the trip or the dosing, but really it's only a small part of the treatment. And as the name suggests, it's psychedelic assisted therapy. So
Right.
it's a therapeutic program, where we prepare, and there is sessions that screens and prepares someone for the psychedelic experience. We're with the person throughout the experience. Yeah, we're kind of like an abiding presence in that. And then, what is most important is the integration of it, of what
Right.
out in that experience. And it's like, you're coming back from a treasure hunt and you're kind of making sense of all the little different things that you've found and putting it together in a way that is going to um, essentially be healing, essentially be
Nice.
um, also transformative in terms of addressing perhaps things about yourself that you didn't know or has always been problematic. And yeah, it just creates those opportunities that I suppose typical pharmacological interventions, whether it be therapy, this can happen in therapy, but perhaps only after 100 sessions. Can happen
Yep.
with, pharmacological interventions, but we know that only can help symptom reduction, and often, requires kind of everyday dosing or regular dosing
Right.
patients. And so these types of interventions, when they will come out, it's very innovative, because what it's saying is that you can get quite long-term positive results with even just like one administration or one cycle
Yeah.
of this treatment. And so
Yeah.
it is very promising indeed. And it is very early days. And so there's a lot of still quite conservative protocols surrounding it. And so it should, because we want it to be rolled out in a safe and in a manner that makes it that makes it I guess trustworthy, of
Right.
trustworthy and delivered by clinicians that have actually been qualified to administer the medicine.
Yeah, beautiful. And I was going to ask you, you touched on that as well, but in terms of the duration of sessions and how, what's the period between sessions? Is this personalized at the moment, or do you have defined protocols?
There are defined protocols, especially the ones that are being administered here in Australia, because we have the Therapeutic Goods Administration set that protocol. So I don't know exactly the timings, but definitely it's the amount of this prep sessions. I think it's like 2 or 3 before the actual um the medicine day, and then between the medicine day and then the next round, you would have
Right.
2 or 3 sessions that can be spaced over 6 weeks, so to have the 3 sessions before you come back and get another one. And then so there's so it's like anywhere between 2 to 6 weeks for one or multiple integration sessions in between, and then you have another medicine day, and then so on, in a retreat format, which is what we will be doing in Portugal. Slightly a little bit different.
Right.
It's a little bit more immersive and controlled. And so our sessions are community as well, community based. And so we have 2 preparation sessions beforehand. So one individually, one-on-one with a clinician, and then one as a group altogether, the way you'd meet all of
Right.
the participants that you will be doing the retreat with. And then there is the retreat, and in a 6-day period, we will have a combination of preparation session, medicine day or dosing day, and then we have integration sessions that are all obviously kind of compact, delivered in-house. And then we have after that integration sessions, one-on-one and group integration sessions for up to 3 months after they have come back. So this is not the same as like you being given the medicine or the substance at a rave and off you go. Completely different setting, completely different purpose. And so I think it's about debunking some of those myths about what it's going to look like, because unless you have specifically gone down this route, many people that would have experience with it, or maybe even if they don't, what the idea that they have is very different to actually like the program that people actually go in and sign up for when they come to the retreat.
Yeah.
Mm.
Yeah, absolutely. And in terms of in your practice, in your experience, what are the main benefits people report? What major differences do you see? And I know it's approved for PTSD and all these issues, but what do you see in practice? That is my question.
What I see in practice is because I work with people that are, let's say, more high functioning, in terms of they might not necessarily have depression or anxiety, but have experienced, perhaps symptoms of depression and anxiety, because they are high performers that are quite stressed and experience burnout. Some of them might have traits of perfectionism, they're quite hard on themselves. They might be people pleasers, or, like, self-sacrifices, they're constantly in caring roles. And so there's like compassion fatigue, and just kind of like, like I said, burnout is a big presentation. So what I've found is that this type of work can help reset um the person's mind, and just give them that kind of sense of peace as a baseline, and to kind of feel more grounded, so that they kind of can get back to, why am I doing what I'm doing? We sometimes people that are seeing me are often in this kind of hamster wheel of being busy, and they kind of forget who they are and why they're doing what they're doing. What is it all for? And I do find that as psilocybin and other research trials have shown, that it increases a sense of openness and connectedness, to people and the world. And often a lot of people that come to me have that level of almost disconnection, almost like a disconnection, disillusion from the world at large, in themselves as well. So it kind of tends to heal that, people come out feeling more connected, to themselves, to others, their relationships, to nature. There is also a sense of openness, so things that they might not have considered before, or if they were kind of quite highly strung, there is a relaxing of that kind of tightness and rigidity. And so there's much more kind of, patience that you observe, or a lot more kind of easygoing demeanor that comes after, that isn't just them trying to be easygoing or them trying to not care. They genuinely would feel quite relaxed and calm, and not as bothered before, compared to before. So that openness is also being shown to be helpful. And creativity is actually another one. Creativity and that sense of kind of excitement towards things again, being able to, because I suppose creativity comes along with a little bit of curiosity and taking risks. Yeah, not being afraid. Kind of connection to, like, going and doing things without overthinking it. Yeah. And so there is so much more joy and playfulness and lightness in life that comes after, people have experienced a psilocybin journey. So I think that from that perspective, this is not even mental health treatments per se, because they're not like targeting trauma, but they're just more targeting overall well-being.
Yeah, absolutely. And there seems to be some intersection with spirituality as well. And, the sense of connectedness that you mentioned with others, the world, which is also very interesting. And I have a curiosity because you are mentioning that some people that might be sort of have the need to control, I guess. And is it easy for people on your retreats and for patients of yours to be able to trust and open up to these sort of therapies in which they know they will, I wouldn't say they would lose control, but there's a sense of not controlling other parts of the experience?
Yes, I mean, that's kind of one of the main concerns I feel like, that going into the journey, they would feel like, oh, well, what's going to come up and I can't control it, which in and of itself is probably part of the presenting problem. Yeah.
Right.
And
Yeah.
and so sometimes, it's about the work is not about just getting them to the retreat. It's about giving them the information and maybe even for that person, maybe just work a little bit more on motivational interviewing and self-awareness, as in, you like to be in control, but let's talk about how, you know, being in control all the time or wanting control all the time, how that has served you. Yeah. And kind of
Right.
being able to kind of um, not just take the control away from the person because we say it's bad, it's getting the person to understand, is it helpful for or is it serving them? Because I imagine if they're thinking about doing something like this or they've looked into something like this, it's already because there are issues that they recognize as not being good, or there's already limiting things, this controlling nature that they have has gotten in the way. And so,
Right.
and this is where preparation sessions are very important, because it's about
Yeah.
reassuring or educating them about some of the things that will come up. And in fact, if that is their fear, is losing control, we work towards giving them the resource beforehand so that if they do come into um the ceremony, like on the day of the medicine, like the journey, if it was challenging, that they would have internal resources to draw from that we've kind of worked together in this person having to be able to handle that. And that in and of itself, to overcome something that you've always been afraid of or thought you've not didn't want, to do or didn't think that you could do. And overcoming that, there's a lot of the triumph and
Right.
empowerment that comes with that, right?
Yeah. Yeah, absolutely. Thank you so much, Aileen. I think I have the sense that we could be speaking for ages about these issues. Um, I would like to ask before we finish, what's next for you? Where can people find you? I know you're going to host a retreat in Portugal. Give us some information about that.
So I'm hosting a retreat in May in Portugal. So that's from the 15th to the 20th. So that's the only date that I have in the calendar so far. But depending on interest, we possibly could also run one at the end of the year in October. So if you are interested and you're listening to this, but you can't make the May date, please still reach out because, I'm collecting information on people that are interested to do this later in the year. And I will be able to probably create that experience for those people. And of course, the work that I do here in psychology in Australia will continue with my private practice. So please check out my work on my website. But also, I'm in the process of getting credentialed to be a psychedelic assisted therapist in one of the clinics that are providing that, what we're talking about, the legal therapeutic goods administration, so the TGA, for people that have the diagnosis of treatment-resistant depression, and that they can access the psilocybin, and for people that have got post-traumatic stress disorder, and they can access the MDMA. So there will be an opportunity to work with me one-on-one. So if travel and group settings and retreats are not your thing, the reason why we do that in Portugal is that because that format, as good as that format is, that is not how it's been legalized in Australia. So we have to go to Portugal where, we can do that legally. But if you do want to get the treatment done here in Australia, there is also a pathway for that. And that's something that I will be able to do very soon with being credentialed. And so please do as well reach out, and then we can have a chat, and I can guide you to what's next.
Beautiful. And to finish up, is there anything that we didn't cover? Any last messages you would like to leave us with?
Not really. I feel like we've had such a robust and massive conversation today. I'm very happy with what we've spoken about. I think if there's anything that is coming up to me as a reflection of our conversation, it's just this importance of integration, right? So not just in psychedelic work, which is I kind of have very much stressed that is really important, is to integrate. I think it's also about our approach to well-being generally. Yeah, that we are talking about lifestyle changes, that we're talking about emotional health, supporting someone through cancer. And what's more vital is this recognition that we're whole beings. It's not just like one thing, and it's not just your physical, it's not just your mental, it's everything put together, and integrating all of that is actually what makes us whole people,
Yeah.
rather than, just like, I was going to say cherry picking parts of ourselves.
Yeah.
And yeah, that it's not a destination, it's a continuous process of growth. And, hopefully that you can do that with compassion, connecting with people authentically, finding meaning in the difficulties. And that's not just with people with cancer. I think that's for everybody, because life is
Yes.
hard, you know.
Yeah.
Easy. That the point is that however you're feeling and wherever you are in your journey, try to not be alone in that experience, because you're not. It's a lot of
Yeah.
people out there in the world that would benefit from hearing about your story, or you being there to hear their story. Um, and that is beautiful.
Beautiful. Thank you so much, Aileen. It was such a beautiful conversation. It was a joy to have you on the podcast. And I'll say goodbye for now. I'll say goodbye to people listening as well. And I'll see you next time.
I'll see you next time. Thank you so much.